I'm getting the signal from my trusty and reliable clerk that we're ready to go. I apologize for appearing virtually. I had a few personal matters to attend to today. Séance, bienvenue à la réunion numéro 41 du comité.
Welcome to the 41st meeting of the Standing Committee on Public Accounts. We're here as part of our study of reports 5 to 8 of the Auditor General of Canada's Report 5 on Chronic Homelessness of Canada 2020-22. All witnesses have had their sound tests and connectivity tests.
From the Office of the Auditor General, Karen Hogan, Auditor General of Canada. Nice to see you again. Casey Thomas, Assistant Auditor General. Sean McLennan, Director. From the Canada Mortgage and Housing Corporation, Romy Bowers, President and Chief Executive Officer. Nadine Leblanc, Senior Vice President Policy. From the Department of Employment and Social Development, Jean-François Tremblay, Deputy Minister. Nisa Tumman, Assistant Deputy Minister, Program Operations Branch. Office of Infrastructure of Canada, Kelly Gillis, Deputy Minister. Janet Golding, Assistant Deputy Minister, Community Policy and Programs Branch. Chris Johnson, Director General, Homelessness Policy Directorate. Before we begin, the clerks inform me we have the time until 5:45. So we have a hard stop at that time. So I'll endeavor to get through as many rounds as we possibly can. Should we exhaust the line of questionings, well, of course, we can always adjourn early, but we must stop by 5:45. And to all our witnesses and guests today, I apologize that we're starting late. Unfortunately, votes in the House of Commons held up members for a little longer than anticipated. So Ms. Hogan, turning to you, you have the floor for 5 minutes, please.
Monsieur le Président,
Mr. Chair, thank you for this opportunity to discuss a report on chronic homelessness, which was tabled in Parliament on November 15th. I'd like to acknowledge that this hearing is taking place on the traditional unceded territory of the Algonquin and Anishinaabe people. Joining me today is Sean McLennan, who led this audit. This audit examined whether Employment and Social Development Canada and Infrastructure Canada work together to prevent and reduce chronic homelessness. We also wanted to know whether the Canada Mortgage and Housing Corporation delivered programs that improved housing outcomes for vulnerable Canadians, including those experiencing chronic homelessness. We found that the organizations did not know whether efforts to date had improved housing outcomes for vulnerable Canadians. Infrastructure Canada did not have all the information it needed to know whether homelessness and chronic homelessness had increased or decreased since 2019. Where the department did have data, for example, on the increased use of shelters by families since 2016, it did not analyze why this was occurring or whether there was a need to adjust its programs. The Canada Mortgage and Housing Corporation did not know whether those most in need benefited from its housing initiatives. The corporation measured and reported on its outputs, such as the total number of units built, but it did not know how many people were being housed or which vulnerable groups were being helped. For example, it did not know whether units intended for people with disabilities were in fact occupied by disabled persons. In addition, some rental housing units that the corporation considered affordable were often not affordable for low-income households and vulnerable groups.
Concerns is the lack of federal accountability for achieving Canada's target to reduce chronic homelessness by half by 2028. The National Housing Strategy was launched 5 years ago in 2017, yet there is still no lead to achieve this target. Despite being the lead for the National Housing Strategy and overseeing the majority of its funding, the Canada Mortgage and Housing Corporation took the position that it was not directly accountable for addressing chronic homelessness. Infrastructure Canada was also of the view that while it contributed to reducing chronic homelessness, it was not solely accountable for achieving the strategy's target of reducing chronic homelessness. Infrastructure Canada and the Canada Mortgage and Housing Corporation were not coordinating their efforts to deliver on the National Housing Strategy's objectives and get a roof over the heads of individuals and families. This was despite the organization's acknowledgement that collaboration and coordination both inside and outside the federal government are vital to addressing the housing needs of priority vulnerable groups. Without a better alignment of efforts and clear accountability at the federal level, Infrastructure Canada and the Canada Mortgage and Housing Corporation are unlikely to meet the country's target by reduce chronic homelessness by half by 2028. Mr. Chair, this concludes my opening remarks. We would be pleased to answer any questions the committee may have. Thank you.
Thank you very much, Auditor General. We'll be turning to some questions shortly, but first we're going to hear from the other three groups. Turning now to Ms. Bowers, you have the floor for 5 minutes, please, for your opening comment.
Good afternoon, Mr. Chair. I'd like to thank this committee for inviting me here today. Chaque nuit, des dizaines de milliards de...
Every night, thousands of Canadians find themselves without shelter. This is a complex problem that requires a collaborative approach, one that takes into account numbers of factors. We could be dealing with economic factors, but it's often connected to health problems as well. When we talk about vulnerable homeless people, this is what we're referring to. And it has an impact on the response that we need to have. CHMC leads Canada's overarching National Housing Strategy, or the NHS, which includes Reaching Home, Canada's homelessness strategy led by Infrastructure Canada.
Programming under the National Housing Strategy that supports the housing needs of vulnerable populations, including those experiencing or at risk of experiencing homelessness. These programs are delivering real results. For example, the Rapid Housing Initiative specifically targets those most in need through the rapid creation of housing units. More than 2,500 housing units for people experiencing or at risk of homelessness are currently being built or are being built with funds from this initiative. And the Federal National Housing Co-Investment Funds supports the creation and renovation of affordable housing. Among its achievements, it has yielded over 3,700 shelter beds, 3,500 supporting housing units, and 1,600 transitional housing beds so far. Addressing chronic homelessness is a multifaceted issue requiring support across all levels of government. CMHC and Infrastructure Canada recognize that reducing homelessness, including chronic homelessness, requires clear accountability, alignment of federal initiatives, and cross-jurisdictional support and efforts. Therefore, we are ready to act on the recommendations in the audit work to more closely support the achievement of this objective. This includes further defining and analyzing the housing needs of vulnerable populations and measuring how our programs are meeting those needs. I believe that it is very important to take this opportunity to point out that CMHC follows rigorous and strict governance and accounting principles in the delivery of its mandate. CMHC knows which population groups are targeted at application and has a process in place to ensure that the units remain targeted to those households over time. We will continue to offer Canadians timely, clear, and transporting reporting that tracks spending and identifies recipients. We have already created a website dedicated to the National Housing Strategy, which includes regular updates of select reporting progress. This data is, however, limited by the fact that the programs are ongoing and the fact that construction projects take time to be completed. We're working on various initiatives, including a project in partnership with Statistics Canada to access more comprehensive administrative data about those being housed in NHS units. In doing this, we carefully consider privacy implications of collecting data on vulnerable populations. We are always seeking ways to improve our reporting. And just as we welcome all ideas that can help solve the problem of chronic homelessness in Canada, we believe that the recommendations in this audit report can help us do both. I am heartened to see the audit recommendations reinforce and strengthen our commitment to close collaboration and to a human rights-based approach to housing. These are the central pillars of CMHC's approach to addressing housing need. And so, in conclusion, I would like to thank the Office of the Auditor General for this report. We agree with its recommendations and appreciate their guidance. Thank you very much for your time today, and I would be very happy to answer any questions. Thank you very much, Mr. Chair.
Thank you, Ms. Bowers. We are now turning to Mr. Tremblay. Vous avez la parole pour 5 minutes.
Mr. Tremblay, you have the floor for 5 minutes. I'm sorry. Mr. Chair, I'm happy to be here today. I'm speaking to you from the unceded territory of the Anishinaabe people. I want to thank the Office of the Auditor General for its work in highlighting the important issue of chronic homelessness in Canada.
Deputy Minister at the Program Operations Branch for Service Canada. Chronic homelessness is a pressing issue. As you know, Reaching Home is actually a $3.4 billion program over 9 years under the National Housing Strategy. It supports Canada's commitment to reduce chronic homelessness by 50% by the end of the fiscal year 2027 to 2028. À l'automne 2021, le programme vers
In the fall of 2021, the Reaching Home program was transferred from ESDC to Infrastructure Canada to support the newly created position of Minister of Housing and Diversity and Inclusion. While accountability for Reaching Home was transferred, Service Canada continues to deliver a portion of the program on behalf of Infrastructure Canada. This was done to ensure continuity of service to communities and was codified through a memorandum of understanding between our departments.
Arrangements to deliver programs on behalf of other government departments. This means that we are still a bit involved in working, particularly with funding recipients, to ensure they provide the requisite information as outlined in the contribution agreements. Merci beaucoup. Je serai ravi de répondre à vos questions.
Thank you, and I'd be happy to answer any questions that you may have with respect to my department and the program Reaching Home. Thank you. Once again, thank you. Now, Infrastructure Canada, Ms. Gillis.
Please.
I thank the Office of the Auditor General for the performance audit of chronic homelessness in Canada. The report makes several important observations about our response to chronic homelessness, and I accept the recommendations. Homelessness is a significant and complex challenge in Canada, and to address it, we need better data and more coordination. When Reaching Home launched in 2019, it followed years of research and engagement with all orders of government and the homeless serving sector, who pointed to the need for a new approach, an approach focused on transparency, coordination, and evidence-based decision-making made at the local level to address their specific context. This involved key transformation where communities are required to implement an international best practice called coordinated access, which requires, among other things, developing a real-time list of all people experiencing homelessness and details regarding their housing and service needs. In order for communities to successfully implement this significant change, new tools, practices, guidance, and modernized systems were required. We knew to make this data-driven approach possible, the homeless serving sector would have to radically transform how it operates. We are making good progress in helping our community partners adapt to this new way of working when the pandemic hit in March 2020, less than a year after the program was launched. The first year of the pandemic saw a substantial shift in shelter services as communities reduced capacity in existing shelters to enable physical distancing, while bringing new temporary facilities online to compensate. In all, 2020 saw a 16% drop in the number of people accessing shelters, while the number of shelter users experiencing chronic homelessness remained steady at about approximately 32,000 people. Since then, communities have reported a 79% increase in the number of people sleeping outside, including in encampments. Naturellement, ce changement de priorité a entraîné de retard.
Understandably, this change in priorities led to delays in implementing coordinated access and new systems to support results reporting.
Over half of the $1.36 billion provided, $708.6 million to be exact, was aimed at helping communities deal with the pandemic-related needs. Among other activities, communities use this funding for medical services, such as hiring nurses for vaccination clinics and shelters, temporary accommodations such as placement in motels, PPE equipment, and help to provide basic services like portable washrooms, hand washing stations to replace what was no longer available during lockdowns. Despite needing to completely adapt their services to respond to COVID-19 pandemic, communities did not stop delivering long-term homelessness prevention and reduction services. Indeed, between April 2019 and March 2021, Reaching Home provided improved outcomes for 62,000 people who were prevented from becoming homeless, and nearly 32,000 people experiencing homelessness who were helped to find housing. The program also addressed some of the root causes of homelessness by connecting nearly 19,000 people to income assistance benefits, over 7,000 people to new paid employment, over 4,000 people to training programs, and over 4,000 people to education programs. Reaching Home improved outcomes for every person who accessed the 18,000 temporary accommodation spaces created when shelters had to reduce their capacity to ensure physical distancing. In fact, there was over 137,000 placements in these types of spaces between March 2020 and March 21. With regard to program delivery, as of November 25th, a total of 33 communities out of 60 have implemented coordinated access, and we are working with the 27 remaining communities to have this program requirement in place by March 31st, 23. Depuis 2019, l'Alliance canadienne.
Additionally, since 2019, the Canadian Alliance to End Homelessness has reported that 8 Reaching Home communities have achieved measurable and verified reductions in chronic homelessness. Key highlights include Medicine Hat, Alberta,
Wellington County in Ontario has sustained a reduction between 10 and 30% of chronic homelessness. Ottawa, Ontario reduced chronic homelessness by 15%. Sault Ste. Marie, Ontario has reduced chronic homelessness by 31%, and Dufferin County, Ontario is on track to reach functional zero, having already reduced by 74% since 2019. Work to sustain functional zero is an ongoing effort. Knowing that some communities still have steps to take, this past summer we issued additional guidance related to coordinated access implementation to clarify program requirements, enhance the ability to communities to determine where they should focus their efforts. Going forward, the government has doubled funding for Reaching Home to continue to support these communities in reducing chronic homelessness. But we know more is needed. That is why Budget 22 announced a research project to support learning about what works in certain communities and sharing those lessons with other communities. Also, a veterans homelessness program will soon be launched that will specifically address the needs of our veterans. The audit report also rightly notes that most recent federal data available on emergency shelters is from 2019. The fact is that in order to continue having accurate estimates of national shelter use, it was necessary for the department to adjust its methodology in light of the creation of temporary shelter space in response to COVID-19 pandemic. This was done, and the national shelter use estimates for 2020 are expected to be released by the end of this calendar year, and estimates for 21 and 22 are expected in 2023. Finally, I would like to address the findings of accountability. I accept our role as leader in Canada's efforts to reduce chronic homelessness. Chronic homelessness is complex and requires active participation from all levels of government, nonprofit organizations, and civil society. A key partner for us in this work, as the audit shows, is the Canada Mortgage and Housing Corporation, as has several mechanisms to address housing needs in Canada under the National Housing Strategy umbrella. For this reason, we are developing a strategy to ensure Reaching Home funding recipients are aware of these funding opportunities that could support their efforts to address homelessness. Internally, we are also implementing formal mechanisms to improve the collaboration between officials that we know will translate into improved alignment of efforts, including within the broader portfolio of infrastructure. Nous sommes déterminés à poursuivre notre travail.
We are committed to continuing our work with other departments, other governments, and with the not-for-profit sector to support the most vulnerable Canadians across the country.
Further about the department's work and our commitment to Canadians and to answer your questions. Merci.
Thank you very much. Some members will notice I did give Ms. Gillis an extra minute there, but we're still well under our time, as we had one or two of our guests who did not use their full time. I just want to remind members very, very quickly, we have a good number of witnesses here today. So as you're questioning witnesses, if you could, if it's not clear who you're putting the question to, please do so I don't have to intervene for clarity. It'll just allow for better flow. And as well, I'll remind members that our last few meetings, I allowed members to go over their time as we were studying the public accounts. I'm going to revert back to my traditional stopwatch here. And if a witness is in the middle of answering a question and the time is expired, I will allow for that answer to be completed within reasonable limits. But the moment you interrupt the witness, your time will end. So you should watch your clock as well, because I don't like to cut off witnesses. Let's begin our first round. Turning to Mr. McCauley, you have the floor for 6 minutes, please.
Mr. Chair, thanks very much. Witnesses, thanks for joining us. A.G. Hogan, Mr. McClellan, thanks for being here in person. I just want to state to start, I have to express my disappointment that not a single witness besides the AG office chose to show up in person today for such an important study. I recognize someone might be out of town or someone may be under the weather, but for every single witness not to show, it's a bit disappointing, but I want to thank the AG for being here in person. AG Hogan, you've read the, I assume, the action plans from the departments. Do you get a sense they're reasonable and that they're aggressive enough to tackle the ongoing issues?
We do review the action plans when they're submitted to the committee here. Some of them are not detailed enough for me to tell you whether or not they're aggressive enough. I must admit that it looks like actions will be taken, but I am disappointed that a lead will only be identified by December of 2023. Which in my view is another year out, which is almost 6 years into the National Housing Strategy, and I believe that federal accountability is important in order to align the programs properly and demonstrate achievement of the target.
Yeah, that was one of my follow-up questions. Is one of the biggest concerns you express is lack of accountability. Do you fear we're going to lose another year if we're not actually appointing someone to be accountable for this for another year?
I mean, I think it's clear over time that that activity is happening. Housing units are being built, services are being provided, but the lack of accountability is not necessarily aligning the programs to meet the needs of the most vulnerable and ensuring that all of the organizations involved are providing the data need to demonstrate achievement or progress towards that. So I do think that one more year just delays the ability to demonstrate the progress. In the audit, we did conclude that we felt it was unlikely the government would meet its target given its current progress and lack of data to demonstrate progress.
Thanks. It's disappointing. In the third paragraph of your opening statement, you commented about organizations not knowing whether efforts to date had improved outcomes. I'm looking at some comments from the housing minister. He's commented 1.1 million Canadians have been housed since 2015. 500,000 housing units have been built. 1.1 million Canadians families met their housing needs under this program. What does he know that perhaps you don't know that? 500,000 houses have been built, but the departments don't seem to be able to communicate or track who's getting housed or who they're helping.
Well, I think I would agree with some of those statements. We show in our report that there are units being built, and that is clearly measured, and the government's being accountable. We didn't look at all of the programs under the National Housing Strategy. We only looked at 6 of them. So perhaps the comments of the minister were more broad. But the point we're trying to make is that building a unit targeted for a group doesn't mean that a member of that group is actually being housed. And in order to demonstrate that you're meeting the needs of the most vulnerable, you need to track that information. It is to measure the outcome, not just the output of creating a unit.
Right. I'm going to switch over to CMHC. Ms. Bowers, there was funny enough, a timely article in the Globe and Mail. I'll read you the headline. Advocate says National Housing Strategy is failing. And this is our National Housing Advocate. She says National Housing Strategy is failing, needs a complete overhaul. What are your thoughts on her critique?
Thank you very much, Chair, for that question. The National Housing Strategy is a significant development in that in 2015...
the Housing Advocate says it's failing. Do you agree with that?
The National Housing Strategy is intended to serve the needs of the housing needs of Canadians across the housing continuum. We have a number of programs.
But our Housing Advocate, who's been appointed by the government, specifically says it's failing. And I just have a straightforward question to you. Do you agree with our National Housing Advocate that the strategy is failing?
I do not agree with the statement. The National Housing Strategy is failing.
That's fair. I'm going to go to your action plan 65.2. It says one of the outcomes is CMHC is better able to confirm who is being housed in NHS supported units. It almost sounds like, if you need to better able to confirm, does that mean you do not know who's being housed in the units?
We have a rigorous due diligence process in assessing the applications that come into the National Housing Strategy portal. We are clear when applications are approved who the housing units are for, the target populations that are
what's
serving.
going on that you have to better able understand?
So because of the nature of the housing...
pardon me, I have a point of order. And at least I heard a point of order.
Yes, it is, Chair. It's the point won't surprise you. I've brought it up before. Questions are legitimate, but let's allow witnesses the space to answer. That's all.
I'd like to address that point of order, Mr. Chair.
Go ahead.
It's not a point of order. This is my time. I'm asking very specific questions, and I would appreciate very specific answers on a very important topic that Canadians have a right to hear. And it's not a point of order. I would appreciate if you direct the member to stop interrupting.
So I, as members know, I think this time is reserved for members. And if a member feels a witness is being evasive, they do have allowance to press that. This did not get to the point of badgering, which I will not allow. But give and take in this committee is to be allowed. So I'll turn the floor back to Mr. McCauley. You have about 35 seconds left, please.
Great. Just follow up on the same question. It should be more of a properly defined target rather than better abled, as you've noted in your action plan.
We are committed to defining the target more precisely, and we're committed to meeting the timelines specified in the audit plan.
Thanks.
And that's your time. Thank you very much. Turning now to Ms. Yip, you have the floor for 6 minutes. Over to you, please.
Thank you, Chair. This is truly a sobering report, and I thank the Auditor General and her team for studying and providing recommendations on chronic homelessness. I remain hopeful that through the recommendations and action plans that more can be done. To Ms. Bowers, Given that the government has agreed with the recommendation on the need to improve coordination between CMHC and Infrastructure Canada on the effort to tackle chronic homelessness, can you speak to the importance of a whole-of-government approach when it comes to homelessness?
Thank you very much for this question, Mr. Chair. Homelessness, as Deputy Minister Gillis has explained, is a very complex issue. It requires close collaboration between Canada Mortgage Housing Corporation and Infrastructure Canada. I am absolutely committed to strengthening the ties between our two organizations. As I noted in my opening remarks, homelessness is about housing, it's about building housing, it's about supports associated with the housing, but it's also about providing the health, the social welfare supports that are required to help those most in need. And as DM Gills mentioned, those supports are often provided by nonprofit organizations as well as other orders of government. And we're very, very committed to working across all levels of government to make sure that we all collectively work towards eliminating chronic homelessness in Canada.
Ms. Gillis, what role does the federal government play in relations to other orders of government when it comes to this issue? Just picking up where Ms. Bowers left off.
Certainly. Thank you very much for the question. At Infrastructure Canada, we lead the program Reaching Home. Reaching Home is really a transformational program where it involves understanding within the communities by name who is homeless and what their needs are. And to be able to service those needs, you do require working with all orders of government. The communities at hand, what are the support levers that are within that particular community, as well as the provincial or territorial supports that are within that community, as well as what CMHC and ourselves and other government departments are doing. So in dealing with some of the complex issues, whether it's multi-generational racism, colonialism, mental health, addiction, those are some of the things that we're addressing when we're looking at chronic homelessness. And those support services are critical and are often provided by the local governments or the provincial or territorial government. So that alignment of work is really important. And the Reaching Home program is the transformation to be able to give the support services to the community entities who are delivering those supports and working with their communities to be able to provide that service.
Thank you. My next question is addressed to both Ms. Bowers and Ms. Gillis. We've often heard about the plight of homeless veterans, as well as seniors, people with disabilities, and women who are also vulnerable. Is there any coordination and integration with other departments to help ensure that the needs of these vulnerable individuals are addressed?
So perhaps I will start. In the budget of 21 and 22, the government had committed to developing a veterans program, which would soon be launched. I mentioned that in my opening remarks. And so that is something that we are looking at and developing specifically with Veterans Affairs Canada and the veteran servicing community across Canada to be able to tailor the program to the specific needs of those who have served our country. We do know there are about 2,500 homeless veterans across the country, and we do want to be able to target the support that they need to get what they require in the particular programs that we're going to be launching.
Thank you. And Ms. Gillis?
Yes.
Oh, sorry, Ms. Bowers.
The only thing I would add is that CMHC often, our programs provide the capital funding for the actual structure of the housing that is required to house veterans or some of the other vulnerable groups that we mentioned, so that we do work very closely with Infrastructure Canada, but also other departments to make sure that there is coordinated access of these vulnerable groups to our programs.
Could you comment on the project with Statistics Canada that you mentioned in your opening statement about accessing more data to address these vulnerable persons?
Yes. So as I mentioned earlier, when we accept an application for our funding, we do ask for information about the vulnerable groups that the proponent is targeting, and we have a governance process to ensure that when the project is completed, that the vulnerable group that has been identified, that the units are actually being occupied by those groups. Because of the nature of the construction cycle, there is a time lag between when the funding is provided and when the information about the occupants is provided, and that provides some gap in our reporting. There are limitations in our reporting because of privacy concerns. You can imagine that, especially with respect to vulnerable groups, there is limitations in the kind of information that we can disclose publicly. We are working on a project, a sort of strengthened partnership with Statistics Canada to gather more administrative data on an anonymized basis to ensure that we have greater information about the vulnerable groups that we're targeting.
And that is the time exactly. Thank you very, very much. Mr. Trudel, bienvenue aujourd'hui. C'est votre tour.
Mr. Trudel, welcome. You have the floor for 6 minutes. Thank you, Mr. Chair. And I'd like to thank the witnesses for coming. The housing is an important issue. Right now, Canada is dealing with serious problems. I have a question for Ms. Bowers. You issued a public release yesterday saying that by 2030, there are 2.5 million units will be built by both the public and private sectors. And then there's Scotiabank that said that they'll be putting money into recently. Those are your own figures. I was discussing this issue with an economist from Laval a few weeks ago, and he said that in Quebec, for example, we have 1.5 million units in line with the figures that you produced, which you talked about yesterday. But they talked about 600,000 additional units. So the government is going to have to intervene to construct 600,000 units to deal with chronic homelessness. The least that we can be said is that for the past 5 years, the National Housing Office has been talking about 100,000 units in total. Just in Quebec needs 600,000 additional units. Homelessness, what we want to do is to put people into housing. That's the national housing. What's what the national housing strategy is out. We're one of the worst G7 countries when it comes to housing. After 5 years of this national housing strategy, we've spent a lot of money. I see that there's a lack of accountability. So a specific question, what are the plans? And just for Quebec alone, we need 1.1 additional housing units. What's the plan to build these additional 600,000 units? How are you going to do that?
Thank you very much for the question, Mr. Chair. Just as a point of clarification, when I talk to people about the housing crisis in Canada, I like to describe it from two perspectives. We have about 95% of the housing in Canada is created by the private sector. We have less than 5% that is community housing or social housing. And the nature of the crisis is different. With respect to housing in the private sector, there is a disconnect between the demand for that housing and the supply. And the supply is created by private sector actors. And one of the things that the government has introduced through the budget 2022 is a program called the Housing Accelerator Fund. The Housing Accelerator Fund is a program to break down barriers that exist at the local level that prevent supply responses from occurring when there is increased demand. We feel that the program is in the process of being developed. We feel that there is a huge potential in that program to work with actors at the local level to break down the barriers to creating housing supply. So that's one part of the crisis. The second part of the crisis refers to the social or community housing sector. We have about 650,000 community housing, social housing units in Canada. It's 4% of our housing stock. It's quite a small percentage as a relative to the total stock. It's one of the lower percentages of the G7 countries. Through the National Housing Strategy, the government has made unprecedented investments in housing, and it is delivering results. And I can provide a large number of pieces of information to you. The target of the National Housing Strategy, as it's currently funded, is to create 160,000 new units of housing funded by the federal government. 5 years in, we're up about 62% completion, and CMHC has made commitments for about 115,000 units. More is needed, and we're absolutely committed to using the existing funds that we have available, but also developing new programs to ensure that there's housing for those in need.
Merci, mais j'aimerais avoir un complément d'information. Vous dites, vous avez...
Thank you. I'd like some additional information. You said you've constructed 160,000 new units. 62% has been completed. How many of these units are destined for vulnerable people? How many social housing units have actually been built?
So I should clarify, the 160,000 new units is the target for the 10-year period of the National Housing Strategy. To date, 115,000 units have been funded. As you know, construction takes time, so that these projects are at various stages of completion. Of the 115,000 units, approximately 45,000 are for deeply affordable housing, if that's your question.
Il y a, dans le programme de
In the co-investment program for the nonprofit sector, these are loans, are they not? The housing is built for people in Montreal. There's a real need to really shake up the NHS to ensure that all the money is sent to nonprofit sectors is used in a way that guarantees housing over a long period of time so that we can help out. Sorry, Mr. Trudel, but you don't have any time remaining. You'll have to wait for another turn in a few minutes.
Floor for 6 minutes, please.
Thank you very much, Mr. Chair. I want to thank the witnesses and the Auditor General for being present with us and for producing this very important report. It's no question that homelessness, housing across Canada is a major concern, not just to parliamentarians, but to folks who are actually living this every single day. I represent, unfortunately, one of the most dramatically underhoused populations in Canada. This is in Edmonton, Alberta. It's an emergency. It's been an emergency for several years now. And when I say emergency, I really want to put this into context that there's consequences to decisions and there's consequences to inaction. In Edmonton, this year or last year, in 2021, there were more deaths recorded in 2021 in Edmonton than the 2 years prior combined. The Edmonton Coalition on Housing and Homelessness indicated that there were 222 identified people who died in Edmonton last year. That represents a huge increase in the years that preceding that. It also is identified in some of the report information we see. In Exhibit 5.4, the report shows that chronic homelessness was 11.3% higher in 2019-20 than the 2016 baseline. So what we're seeing here very clearly in Edmonton is what we're seeing right across the country, an increase in the amount of folks who are identifying as houseless across cities, from city to city to city, from coast to coast to coast. You mentioned in your statement, I forget which official mentioned this, but it's also in the report, but the target was a 31% decrease. So the target was to decrease by 31% in the year 2023 and 2024, and a 50% decrease in that demand by 2027 and 2028. To have a chance of actually achieving that goal, chronic houselessness would need to actually fall by 38% between 2020 and 2024, and by 55% by 2020 and 2028. So it's going to be an incredible challenge, I see, and just how far behind we actually are in hitting these targets. In my community, you don't have to look far. I encourage many members to come to Boyle Street, come to Macaulay, come to Alberta Ave, and witness some of the dramatic increase in houselessness across our city in Edmonton. The programs may not be working. We're here to figure that out. And so I'm really pleased to see the Auditor General table a report that's going to give us an opportunity to talk about accountability. We don't only face a crisis of housing, we also face a crisis of accountability. We need to understand how these systems are functioning. Canadians deserve to understand how these investments work, and Canadians need to understand that these investments are actually hitting targets. I was so disappointed in this report to see that we don't know the targeted information of those vulnerable populations that were served. If we truly are going to have a program that's outcome-based, that talks about and addresses houselessness, these critical factors must be included. We can't simply talk about the pure units, the number of units, without understanding who is in those units. That is a critical piece to the Auditor General's report, and one that this committee is tasked with trying to enforce some accountability towards, and understanding why we'd see a national housing strategy built without the target of ensuring that vulnerable folks actually got placed in housing. This is strange that we're talking more about units than about the people those units should serve. So it's incredibly important that we talk about the programs and the outcomes that we expect and that Canadians expect. So my question would be to CMHC, Infrastructure Canada, and ESDC. One, who is ultimately responsible for achieving the National Housing Strategy targets? I want to preface this by understanding that the Auditor General points out very clearly that each three of the members the departments mentioned had a failure in trying to interact with one another in a way that was going to produce the best outcomes. And so, starting with CMHC, who is responsible for achieving the National Housing Strategy?
And just let me
Targets.
I just want to interrupt, and I've paused the time. Mr. Desjardins, you've got about a minute 40 seconds, so I'm going to let you it sounds like you want to hear from everyone, so I just want to put you on notice that you've got about a minute 40 seconds, okay?
Thank you, Chair. Quick with the
CMHC.
responses.
And so CMHC is responsible for the overall national housing strategy and all its targets. We work in collaboration with Infrastructure Canada on the homelessness target.
Thank you very much for that. Infrastructure Canada.
Thank you. As Ms. Bauer said, we work in collaboration on that particular target. Infrastructure Canada is responsible in leading on the program Reaching Home, which is a really important program. It is outcomes-based, and we're working with communities to have the data that you have mentioned. So each community, and we are making headway as we're operating and implementing coordinated access to know who is in their community, what housing and service needs they need, and for us to be able to monitor that. That was impacted by COVID, but we are on track now with our 60 community entities. Half of them have coordinated access, and it's giving us much better data on the impact of those in society and for what needs they have, and for us to be able to adjust our programs to be able to service those needs.
ESDC.
Merci pour la question. Thanks for the questions. For us, the role is quite limited and simple. We support infrastructure in some of the aspect of the Reaching Home service delivery, program delivery.
I think that's my time. Oh, sorry.
Okay. No, which means, for example, the relationship with the recipients from the contribution agreements perspective.
Very good. That's your time. No, I paused the time there, Mr. Desjardins, when I interrupted you, so I will not take your time. Turning now to our next witness, I believe it's Mr. Aitchison. Welcome to the committee. You have the floor for 5 minutes.
Thank you, Mr. Chair. It's an honor to be here. Thank you to all the witnesses and to the Auditor General. My first question is for either representative from the Auditor General's office. We heard from the CMHC that they follow rigorous and strict governance and accounting principles in the delivery of its mandate. Would you agree with that statement?
This audit really didn't look at CMHC delivering on its mandate. That would be something that we would do in our special examination. Here we really did look at the management of 6 projects under the National Housing Strategy and whether or not they were accountable for the achievement of a key goal in that strategy, which is to reduce chronic homelessness by 50% by 2028.
So you'd say that they did not follow rigorous accounting strategies when it came to that particular part of their mandate?
They definitely track where money's going. They're accountable. They have agreements in place for who they lend to. They can track the units being built. But our main finding was that tracking the outcomes of who is ultimately housed and whether or not these initiatives have improved the lives of the most vulnerable, they were unable to demonstrate that to us.
Thank you. Next question would be for ESDC. I know that the Parliamentary Budget Officer reported that an average of $118 million a year was spent on homelessness programs, and it was bumped up to $357 million a year, and yet homelessness is on the rise. I guess this speaks to the importance of tracking and accounting for where the money is spent. Can you, Mr. Tremblay, explain to us why, or in any sense, where that money has gone if homelessness is in fact on the rise?
As I mentioned before, the role that we still have is to manage some of the programs on behalf of Infrastructure Canada. So I would defer to my colleague at Infrastructure Canada to explain, as she has done a bit already, where the money is flowing and for what.
Thank you. Thank you, Mr. Chair. So I would like to acknowledge that of the $1.36 billion, $708 million, and we can account for every dime of it, has gone to emergency measures during COVID, to doing things like I mentioned in my speech, PPE, vaccination clinics and shelters, hand washing clinics or facilities. So things that temporary measures to be able to have social distancing so people could have a safe place to sleep. So it was really about keeping people safe during the crisis. So the top up and the increase during the COVID period was to deal with the health crisis at that particular point in time.
So, Ms. Grelis, if I can jump in there, if you don't mind. Reaching Home spent $1.636 billion between 19 and 21, which is about 40% of the budget. So why have you only spent 40% of the budget? Considering the fact that homelessness in Toronto, for example, is on the rise. It's on the rise in Winnipeg. It's on the rise in every major city. 10 cities are growing literally across this country. The city of Toronto has reported that 216 homeless people in Toronto died last year. That's 4.2 people per week. 40 people a day on average are turned away from homeless shelters in Toronto last year. That's up to 63 people so far this year. Why do you only spend half the money?
So thank you very much, Chair, for the question. This is a 9-year program. Originally, it was set at $2.1 billion. It was topped up during COVID to deal with the pandemic and that crisis. The government since, in Budget 22, has continued at that doubling level until the end of 25-26 to continue to increase its support for the homeless community. And so it is over $500 million a year that we're supporting communities across the country in bringing in a transformational program to support communities and knowing their population, what housing and support needs they have, and to be able to work with the community support servicing nonprofit organizations, provincial and federal governments to be able to provide those supports. So the government has doubled its support for Reaching Home during the COVID time period and will extend it past the COVID time period.
Thank you. Quick question for Ms. Bowery. How many employees are there at the CMHC, roughly?
There are roughly 2,400 employees.
And how many of those employees would be responsible for delivering on the 6 main national programs of the National Housing Strategy?
I don't have the precise number, but I would guess about 40%.
And so when the National Housing Co-Investment Fund has only spent about 50% of its budget, the Rental Construction Financing Initiative has only spent about 53% of its budget, and the Auditor General has told us that we don't really know how many people have been helped or if it's really working. I'm wondering if you can explain to us, number one, why only half the budget's been spent.
And I'm afraid I'm going to have to wait for an answer on that. I apologize about that. Your time is completely gone. I'm now going to turn to Mr. Dong. You have the floor for 5 minutes.
Thank you very much, Chair. Thanks to all the witnesses for coming to today's meeting. It's a very important discussion here. My first question is for the Auditor General. Auditor, have you done any audit on government's performance dealing with homelessness in the recent past, let's say last 5 years?
No, not in the last 5 years.
Okay. And Reaching Home just started in 2019. And first, I want to go to Ms. Gillis, because my understanding is Infrastructure Canada is the ministry that's responsible to deliver Reaching Home. Is that correct?
That's correct. It was transferred to us in the fall of 21.
Oh, transfer to 20. Okay. And who was responsible for it before transfer to your department?
ESDC.
ESDC. Okay. And to your knowledge, do you know if ESDC had a chance to carry out what was said in the strategy due to the start of the pandemic, also in 2019, very early on in March? Were they able to roll out some of the parts of the strategy?
So I will begin and then see if Mr. Tremblay or Nisa Tuman would like to add anything. So during the COVID period of time, it was less than 1 year of the new Reaching Home program that was launched, and it was a transformational program. And so the homeless serving sector did need to transition their own services to just keep people safe. That said, as the Auditor General noted in her report, 9 community entities across the country did implement coordinated access, even though they were managing during a COVID period of time. And since then, we do know as of right now, we've got about half of our community entities that have implemented coordinated access. And as I noted in my opening remarks, we're seeing results for those community entities who have implemented that new program. And so we're seeing reductions in chronic homelessness.
I'm sorry, could you repeat your last sentence because the connection wasn't very good. We couldn't hear you.
Oh, certainly. What we are seeing as of right now, as of November 25th, we've got about half of our community entities that we fund, approximately 60 of them across the country, have implemented the program, what we call coordinated access, which is an international best practice where you have an information system that all the service sectors use the same information for knowing who is homeless in their community, what is their housing needs, and what are their support needs. And so it can be done in a very efficient and effective way where people in that community can coordinate the efforts to be able to provide the right services to that particular individual. And we've got half of our community entities across the country who have now implemented that particular, it's quite a transition and transformational change in the way that nonprofit and the homeless serving sector actually operates. And we provide them an information system free of charge to help them do that. We've also worked with the Canadian Alliance for Ending Homelessness to help them provide technical assistance to make that transition. And now what we are seeing in some communities, like Medicine Hat, Alberta, for example, or even Ottawa, reductions in chronic homelessness because they have implemented coordinated access. Now, that said, we know we need to do more, and that's why in Budget 18, they gave us a little bit of additional funding to work with communities across the country to understand what's working, what do we learn from it after you've implemented coordinated access, and what more do you have to do on top of doubling the funding of Reaching Home to the end of 25-26 to be able to provide more support to communities in implementing this important transformation.
That's very good. You said half of the communities are implemented. How many is left, and what's the plan to complete the project?
So thank you very much, Chair, for the question. There's 27, outside of Quebec, there's 27 community entities that have to implement coordinated access. And by the end of December this year, we will have a detailed plan to help help the community entities implement that particular new transformational system. We have, as I mentioned, engaged with the Canadian Alliance for Ending Homelessness, who is going to be providing technical assistance to those 27 community entities, as well as we're going to be doing workshops and in the summertime, and we will continue to do so, issued additional guidance to communities to help them be able to make that particular transition. So we will be doing very customized support to help those communities be able to reach the program requirements because we know it's going to make a difference in those communities.
Thank you. I didn't interrupt you. Okay.
Yeah, that's your time. Could I just ask, Ms. Gillis, could you just modify the location of your mic a little bit between your upper lip and your nose? There's a little bit of feedback right now. It's just not clear enough for the interpreters, but if you can just kind of move it up.
I've moved it up. Is that better?
Oh,
if I speak
that
like
seems to be better. I'll just wait for the
Okay.
clerk to signal
Okay.
looking at translation, but that's much clearer. I can even tell on that. So, okay. Thank you very much. Thank you. Maintenant, Mr. Trudel, vous avez...
Mr. Trudel, you have the floor for 2.5 minutes. Thank you, if I may. I'm going to be sharing my time with Mr. Morris of the Green Party, so I'll just be speaking for 1 minute and 15 seconds. I just have a question. Do you want me to cut you off after 1 minute and 15 seconds, or are you going to do it? Because often the MPs speak longer than that. It's better if you do it, Mr. Chair. Okay, thank you. Ms. Bowers, there are a lot of cases in Quebec, housing projects that can't get going because of a lack of labor. This is very worrisome. There are a lot of cases throughout Canada. Is there anything that's been done? We're talking about good projects here to help vulnerable people. Is this something that's been drawn to your attention, or do you have any plans to build up to invest in these projects once they get going?
Thank you for that question, Mr. Chair. CMHC believes that increasing the supply of housing is absolutely important to increasing affordability of housing. One of the barriers to bringing supply online is the lack of skilled trades in many regions across Canada. There are many programs at the provincial and territorial level to increase the number of students going into the skilled trades. We think that is a great thing. There's also initiatives under immigration programs to attract skilled trades immigrants to Canada as well. I think those are very positive developments to increase the supply of housing. In addition to that,
I'm going to stop you right there. Mr. Trudel, vous auriez une autre tour.
Mr. Trudel, you'll have another turn, so you can go back to the subject.
To Mr. Morris.
Merci, Monsieur
You have the
Trudel.
floor. Yeah, and you have the floor for about 1 minute and 13 seconds. So I was pretty good on the time there.
Thank you, Chair, and merci, Monsieur Trudel aussi.
Thank you, Mr. Trudel.
Report, it mentions that Infrastructure Canada, Employment and Social Development Canada, and the Canada Mortgage and Housing Corporation didn't know if their efforts were improving housing outcomes for people experiencing homelessness. I want to share with you data from in my community. In the time since the National Housing Strategy was launched, the number of people experiencing homelessness has tripled, up from 333 people to 1,085 people experiencing homelessness in my community. This is what the crisis looks like on the ground. So with 30 seconds left, I guess a question to CMHC. Ms. Bowers, if there's one change that you feel needs to be made to CMHC in order to reduce the number of people experiencing homelessness as opposed to having it tripled, what change do you think is needed?
the National Housing Strategy started as a $40 billion program. It's grown to a $70 billion program. It's a very ambitious initiative, and I would encourage the government to expand its scope. And we at CMHC are committed to making sure that the funds are directed to those most in need.
And that is the time. Thank you very much. Turning now to Mr. Desjardins, you have the floor for 2.5 minutes.
Thank you very much, Mr. Chair. I quickly want to turn to figure 5.76 in relation to the Canada Mortgage and Housing Corporation, not knowing that it had, not knowing whether or not it was improving housing outcomes for vulnerable Canadians and contributing to the prevention and reduction of chronic homelessness. In addition, that same section says that the corporation did not know who was benefiting from its initiatives or whether housing outcomes were improving for priority vulnerable populations, including people experiencing chronic homelessness. We also concluded that rental housing, considered affordable and approved under the National Housing Co-Investment Fund, was often unaffordable for low-income households, many of whom belong to vulnerable groups. When I hear that figure, you must understand, particularly members of the CHC, how concerning that is when we're talking about massive scale investments, not actually getting the results and being able to demonstrate those results simultaneous to seeing the reality on the ground in my communities, in Boyle Street. These are real places that are having real impacts. 222 people, almost 460 people died in the last 2 years. This is happening in our backyards, and we need to find some ways to get some accountability. So my question is clear, in that how can we have any faith in CMHC's ability to deliver an affordable housing when we don't know how to measure affordability, and when the OAG found that your definition of affordable housing was out of reach of low-income households? To CMHC.
The National Housing Strategy is comprised of a number of different programs. The level of affordability that is targeted is different depending on the program. There are a number of programs that are very targeted and directed towards vulnerable populations. For example, the Rapid Housing Initiative. This was a program that was developed during the COVID crisis. We have delivered over 10,000 units in funding commitments for housing units serving those most in need. Many of these units are still in the process of being constructed. We can confirm who is using these units once the construction is completed. There is a timing lag that's created in the provision of this data, and CMHC is very committed to providing greater transparency and making sure that the gap between when we receive this information and when it's available to the public is closed. We accept the recommendations of the Auditor General, and we feel that we can work much more collaboratively with Infrastructure Canada to make sure that there is greater transparency and accountability about these outcomes.
Thank you. And that is the time. Turning now to Mr. Genuis, you have the floor for 5 minutes.
Thank you, Chair. Reading this audit reminded me of an episode of one of my favorite TV shows, Yes, Minister. There's an episode in there where there is an empty hospital that has been empty for months and is nonetheless employing administrative staff. And the public servants assure the minister that it's one of the most hygienic hospitals in Britain. This is really horrendous stuff, though, in all seriousness. I mean, just reading from the audit here, as the lead for Reaching Home, a program within the National Housing Strategy, Infrastructure Canada spent about $1.36 billion between 2019 and 2021, about 40% of total funding committed to the program on preventing and reducing homelessness. However, the department did not know whether chronic homelessness and homelessness had increased or decreased since 2019 as a result of this investment. So essentially, what the Auditor General has concluded is that the government, despite spending billions of dollars on combating homelessness, can't measure, can't track homelessness, can't in many cases track it overall, certainly can't effectively know the impact of the measures it's implementing, whether the money it's spending is actually making a difference or not, and how the overall picture is changing. And I think one conclusion for me from this is that the government doesn't actually have a national housing strategy in any meaningful sense. They have a document called that with aspirational goals, but are not measuring progress towards those goals in any meaningful way, which hardly merits the term strategy. And I think it is important that the committee hear from the minister at some point to provide some explanation for this shameful balderdash. I guess I just want to ask our public servants, though, it doesn't seem to me it should have been necessary for the Auditor General to point this out. For ministers and for public servants that were working on the National Housing Strategy and have for a number of years, and presumably noticed that there was a lack of measurement or benchmarks, why did it take the Auditor General pointing this out for you to note that maybe something was wrong here? Maybe I'll hear from all the departments. We'll start with Ms. Gillies at the Office of Infrastructure Canada.
Thank you, Chair, for the question. What I can say is during the audit period that we were during the COVID time, the community entities, we gave them a delay and an extension to report the results of their spending. What I can tell you now is with the money that was spent, aside from the $708 million that I already talked about for emergency measures. We supported 3,378 projects. That supported almost 32,000
I'm sorry,
people
ma'am, but that's just
for
not
being
my
placed
question,
in-
right? Did you think there was a problem vis-a-vis measurement prior to the Auditor General's report coming out?
During the audit period, during the COVID period of time, we gave an extension for the reporting of the results. So since that time, we do have the reporting of the results for the first 2 years of the program, which have made measurable impact of placing 32,000 people in stable homes. A year later, 70% of them are still placed in those homes. It had 82,000 people or 62,000 people who were prevented from becoming homeless. We put 8,100 emergency support measures in place. So the community entities that we fund across the country
I'm sorry, but just respectfully, I mean, what the Auditor General has concluded is that there is a lack of basic information about the overall picture, about how we're progressing towards the overall picture, and in many cases, just basic numbers are not being kept. And I don't have time to go through all of the officials at this point, but it would be nice if there was some acknowledgement that there was a grave problem here. Maybe if I can bring in one of the other officials, let me put it this way: is there anybody here who wants to acknowledge go ahead, Mr. Tremblay, the grave problem we have? Yeah, go ahead.
If I can answer quickly to your questions. I remember the hospital, and yes, ministers like you, but in the hospital, there was no patient. This is not the case here. There's been funding, there's been programs, there's been progress.
We just don't know if it's working, right?
Just if you can let me
Please,
finish.
yeah.
What happened during COVID is that we decided that those groups were getting more money, had to transform the way they deliver services during COVID, face the challenge of COVID. If they were not able to report in time, we postponed the report. That's why a lot of the information didn't come in time, but it's coming. So we'll see with this information, as my colleague from Infrastructure Canada mentioned, some of this information is coming, and they're getting now some of the trends and what exactly the money is achieving.
And thank you very much. That is the time. Turning now to Ms. Shanahan, you have the floor for 5 minutes.
Merci beaucoup, Monsieur le Président.
Thank you, Mr. Chair. I'd like to continue on the same vein that my colleague was alluding to. I think there's a misunderstanding, perhaps. So I'd like to ask Ms. Gillis, who is responsible for data collection? In the agreements with the communities, they need to have data and they need to provide this information. But during COVID, we gave an extension to the communities because they were very busy. And who are these community groups? Are they tied to the federal government? Or are they tied to the provincial or municipal levels of government? It's a mix. Often, these organizations, these nonprofit organizations, receive funding to provide services in their communities. So why are you working with these groups? You talked about, you said that this was a transformational program. We're expecting results. What is so difficult with this? Can't you just associate the money spent with the number of units built?
Merci pour la question.
Thank you for your question. For the program Reaching Home, it's really to provide funding to provide to these communities to provide vulnerable people with services, maybe to supply them with temporary housing, for example, or help them put on educational programs. It's not for buildings, it's for services.
Potentially addiction services. So linking them to the actual help that they need depending on their individual circumstances. And that's where we work with nonprofit organizations for them to have an information system so that the person who's homeless doesn't have to go through their community to different organizations trying to find the help that they need. Instead, it's centralized and coordinated by all the homeless serving sector within that particular community. And it is an internationally recognized best practice. And now we are seeing some of the fruits of that practice being put in communities across the country, but we know more is needed. And that's why we're working on first of all, doubling the funding to those particular community entities over the next number of years so they can do more, as well as doing further analysis and understanding once you've actually put in this transformational coordinated system, what more do communities need to be able to deal with this very complex, serious problem.
Well, thank you for that. And I know you did mention that there's been tremendous success, but you mentioned apart I forget how you said it exactly, but Quebec was not included in that number. So I'd like to learn more about that because in my community in Chateauguay-Lacal, we've had a tremendous progress with a project in the Rapid Housing Initiative, which would address at-risk youth. And I'm so thrilled. We're working with Ganawage. This is a first for Chateauguay to work with Ganawage in transforming what was an eyesore, an old hotel on our main street. Can you talk to me a little bit about what agreements you have with Quebec?
Thank you very much for the question, Mr. Chair. With Quebec, we work directly with the province, and the province works with community entities. And we've just reached an agreement with Quebec to implement coordinated access. We have 7 community entities within that particular province, and we're working on a detailed implementation plan. So we'll be advancing coordinated access within the province as well.
How much time do I have, Chair?
Well, you've got about 30 seconds.
Okay, I do want to ask about measures and how they're put together. So we had a strategy, we have targets. Are the measures not included within the strategy? And I don't know who can answer me on that. Who wants to make a leap at it?
Yeah, so I can you hear me okay? I have a bit of an echo, but yes, there are 7 indicators of success that we track very closely for the National Housing Strategy. And just to give you a sense of what some of these indicators are, it's things like how many households have their housing needs either significantly reduced or eliminated. That's a measure that we track. We also track how many new housing units the government has funded. We look at existing community housing stock and the number of units repaired or renewed. We also look at preserving community housing stock and how the federal government's investment is protecting community housing stocks. We have numbers associated with that as well as progress. We have Canada Housing Benefit, which is not an investment towards...
I apologize. I'm going to stop you there because I'm well over, but I suspect a member might come back to you on this, and there might even be a request to see that information, but that's not for me to say. I'm going to turn now to our next round. This will be our final full round. We might have time for a few other questions at the end. Turning to Mr. Aitchison again, you have the floor for 5 minutes.
Thank you, Mr. Chair. I'd like to return to the question of the report when it's come out, and back to Ms. Bowery. One of the bigger concerns that I have with this report is it's bad enough that an organization that is really one of the main mandates of the organization is to do a lot of research on housing in general is not doing a good job of keeping track. But the bigger concern I have is this business that no one really seems to know who's the lead, and we won't have one until I hear next year, which seems particularly odd to me. So I guess my question then to you, Ms. Bowery, is how often do you meet with the Minister of Housing and Diversity and Inclusion?
I meet with the Minister on a regular basis.
Minister, since report number 5 of the Auditor General has been released to discuss the findings?
Yes, I have.
And did the Minister express his concerns? Have you come up with an action plan to solve the problem with the Minister?
As part of our regular process, the Minister would review the action plans proposed by CMHC and Infrastructure Canada and would have the opportunity to ask questions and approve it.
When you worked at the Bank of Montreal I'm assuming that the bank had a bonus structure for employees for, great work. Did they have a bonus structure at the bank?
Yes, the bank, like many other organizations, had a total performance system that included bonuses and other benefits.
So the CMHC, I understand, gave about $48 million in bonuses in 2020 and 2021. How many employees would have received a bonus?
So in 2022, our bonus expense amount was about $30 million. And I don't have the exact number of employees who received it, but I can certainly get that to you as required.
And the bonus structure at the CMHC, it's predicated on what? On great performance, I'm assuming, or what? How does it work?
When we're looking at our total compensation, it's based on performance, but also we do benchmarking on a regular basis to make sure that our compensation package is aligned with competitors in the private sector as well as the public service. CMHC has a dual mandate. We provide a competitive insurance product and compete with the private sector for employees. In addition to that, we deliver appropriation-based business as well. So we take that into consideration in determining our compensation structure for our employees.
I'm assuming the insurance part of the business is doing a lot better, considering that we've only spent half of a couple of programs and the housing situation in Canada is getting worse. I assume that maybe most of those bonuses went to the insurance side of the business?
CMHC takes performance management very seriously. We have a series of internal performance targets that we cascade down to our employees, and we ensure that, for example, some of the housing targets that I mentioned to you, that those are being met on a regular basis.
So, while tent cities are growing, there are more homeless people in cities that are dying. The number has doubled in the city of Toronto. We have housing officials and bureaucrats getting bonuses, $48 million. How much of that $48 million in bonuses would have gone to the people that are working in the National Housing Co-Investment Fund or the new Rental Construction Financing Initiative? How much of the $48 million? Half of it, 40%, sort of like the same ratio of the employees involved in those departments, maybe?
I'm sorry, I don't have that level of granularity available, but I can certainly provide that upon request.
It seems perverse to me, actually, and I'm sure it seems perverse to the people who don't have a home and are living in tents. I wonder how much $48 million could buy in tents for places across this country, from Vancouver to Charlottetown. I'm frustrated by this, and I think that we need to do an awful lot more. I appreciate the Auditor General giving us this report because it's told us that we're not getting the job done. The Parliamentary Budget Officer has told us the job's not getting done. Nobody's accountable, but people are getting bonuses. You can imagine my frustration and the frustration of the people that I represent. Thank you.
Mr. Atchison, you've got about 10 seconds left. There were several offers for documents. Do you want to request those documents that were offered? You need to do that, otherwise they won't be sent. Please make that request.
Thank you, Mr. Chair. I didn't realize I had that time, but yes, I would like those documents. Thank you.
Thank you very much. I'm now turning to our next member, Mr. Fragascatos. You have the floor for 5 minutes.
Thank you, Chair. Thank you to the witnesses today. I wanted to begin by asking Ms. Bowers a question relating to something you raised earlier, which was the Housing Accelerator Fund. And I asked that in light of the fact, and it is a fact, one that should not escape the attention of this committee, that housing and homelessness are not just the business of the federal government, but need to be addressed by all levels of government. This is not to absolve the federal government of its responsibilities, certainly. But just this past weekend, I listened to two economists, one from the Smart Prosperity Institute and the other from the C.D. Howe Institute, outline how municipal policy and distortions in terms of supply and demand do give rise to homelessness. The point was made that when you have people driving until they qualify, if I can put it that way, as has been especially the case in Southern Ontario and especially the GTA being very expensive in terms of housing. People would go outside of the GTA find an interest rate that suited them. And in turn, those middle-class folks, once they settled in communities, would go into areas, buy up homes. Those homes would be renovated, gentrifying the area, and you have the problem of renovictions taking shape. That renoviction challenge does lead to homelessness in some cases, not in all cases, but it can. The point that where I'm going with this, Ms. Bowers, is how can the Housing Accelerator Fund help to deal with the challenge and specifically the supply-demand distortions that we see in municipalities, so more housing can get built, so we can meaningfully address the challenge of homelessness? Because I do think that municipalities are partners. I do think that the Accelerator Fund can help in this regard, but how do you think that it can help address what I've just outlined?
Thank you very much, Mr. Chair. I believe that we need to have a healthy housing system as a whole to address homelessness and housing affordability. As I mentioned in my earlier remarks, 95% of the housing in Canada is provided by the private sector. There is a huge demand for housing in Canada, particularly in our large cities, and there's been impediments for the private sector to provide the housing that is needed. The purpose of the Accelerator Fund is to provide incentives to municipalities and other local actors to clear away some of the barriers for some of those supply responses from taking place. At the federal level, because we have a system that is free market oriented, this is one way that we can use the federal fiscal powers to create incentives, to create changes at the local level. Housing is a very local problem, and there's unique challenges in cities and communities across Canada. And the purpose of the fund is to be flexible enough to provide funding to help local officials, local politicians break down local barriers and bring on supply much more quickly than it has in the past.
Thank you very much. And I know that municipalities have their share of challenges, of course, but in certain communities, my own included, in London, Ontario, we're not seeing enough housing get built. And when you don't have enough housing get built, and when you have very high demand, you do have problems that can lead to homelessness. So I'm looking forward to the Housing Accelerator Fund, looking forward to seeing how that can help municipalities. Chair, just with the last question, and I just want to read it here. It is one of the key recommendations in the auditor's report, and it says the following: the Canada Mortgage and Housing Corporation and Infrastructure Canada should align, coordinate, and integrate their efforts and engage with central agencies to clarify accountability. I don't know that we'll have time to hear from both, but to Infrastructure Canada, since I already went to Ms. Bowers, what is being done specifically to better coordinate with CMHC so that this recommendation can be realized?
Thank you, Chair, for the question. We've already have an Assistant Deputy Minister Coordinating Committee that has been in place, and it meets biweekly, as well as working level meetings between ourselves to make sure that we're coordinating our programs. And just going beyond CMHC and ourselves, CMHC and myself met with our housing provincial and territorial colleagues yesterday and struck a working group between housing and homelessness so we can coordinate our efforts, not just from a federal perspective, but a provincial and territorial perspective, which is also extremely important to make sure that we're using and leveraging all of the resources that help our communities across the country.
Thank you. That's excellent time. Just a few seconds over, so I appreciate that from you both. Maintenant, Mr. Trudel encore.
Mr. Tail, you have 2 minutes and 30 seconds. My question is for Ms. Gillis. Please be concrete. We talked about community organizations. You work with these communities. They have to provide reports. What we found out is that the reports go through Health and Social Services in Quebec, and since 2021, well, apparently this has been an issue in north of Montreal. We know that we need heated units for people, and people, especially for people who are going to have to sleep outside in Longueuil, there are some centers that are going to close down shortly. Last winter, they lodged 37 people, but they're there every night. But now there's a lack of funding for them. So I'm trying to understand how this is working. These communities are asking, organizations are asking for money to help with homelessness. But if the reports don't get you, what can we do to help them? The information never gets to the proper authorities, to you. You could be helping with funding for these organizations.
Merci, Monsieur Président.
Thank you, Mr. Chair, for your question. With Quebec, we work with Quebec, and it's the province that determines what needs to be done. We work with the province on the Reaching Home program, and I do know that we need more money. That's why we doubled the money allotted to Reaching Home, because they do need more money in order to provide services and help people who are homeless. But how do you know? The report, you never get the reports. So how do you know what the needs are? During the pandemic, we extended the deadline to community organizations, but now we've started getting these reports in from everywhere across Canada, and with Quebec, we work with the province in order to get the results. And that's it. That's it for you, Mr. Trudel. You may have another additional minute later on, but not right now. Now, Mr. Desjardins, you have the floor for 2 minutes.
I really want to emphasize the importance of ensuring that the witnesses understand the purpose of this committee is to ensure that we utilize the words of the Auditor General, who's made very clear in her report that there's systemic failures within CMHC, Infrastructure Canada, and ESDC, in particular in the operations of data collection for outcome and for the cooperation between all three ministries, or all three groups. It's imperative that this committee understand that the director of CMHC understands that this is truly a measure of accountability for Canadians, and that we expect far more than the answers that we've been receiving today, and admission that it's important that you understand that the Auditor General's reports are important to Canadians and that you must heed the advice of not just this committee, but of course the Auditor General. Chronic homelessness was 11.3% higher in 2019 and 2020 than in 2016 baseline. It was just mentioned by CMHC that their plan is to ensure that they can incentivize the private market to ensure that they are building the supply. We're seeing that their plan is resulting in an increase in homelessness. Does CMHC think that the private market can continue to be incentivized to build the appropriate number of units? Yes or no?
The private sector cannot provide housing to support those most in need, for those at risk of homelessness and those who are most vulnerable. That's the role of government. CMHC has a number of programs that support those Canadians who are most vulnerable. The role of the private sector is to provide housing.
What do you believe the role of public housing is in Canada, and is there sufficient investment to ensure that we actually have the kind of public fund or the funds to actually build public housing? Is there enough money? Do you have enough money?
So the National Housing Strategy was a very significant development in that it represents a return of the federal government into investing in public housing, in social housing.
See, now I'm concerned about when we transfer funds to for-profit developers that we see an increase, especially in the rental program, an increase to the total cost of rent and making it even more out of reach for those persons. We've seen that report just this summer and last summer out of Toronto, where we're seeing larger increases to rent that are receiving funding from CMHC that are leaving these units out of reach. Why are we seeing this?
Mr. Desjardins, that is your time. but I'm hoping you'll have another minute in our next round. Turning now to Mr. Genuis. You have the floor for 5 minutes.
Thank you, Chair. So, as we've been talking about, this report from the Auditor General reveals significant gaps approaching a total absence in terms of data collection and evaluation with respect to the government's performance on attempting to combat homelessness. The findings of the Auditor General are pretty clear, and the members, at least of the opposition, and maybe some members of the government are gravely concerned about these findings. But I'm getting the sense from the responses to some of these questions that there's not a fulsome recognition of how damning these findings are. So maybe just a simple question, and if we could go through the deputy ministers, and more or less a yes or no should be fine for this. Do you agree that something has gone gravely wrong here? We'll start with Mr. Bowers. Pardon me, Ms. Bowers.
I accept the findings of the Auditor General and will take concerted action to implement the recommendations. Okay.
Do you acknowledge that those findings are that grievous errors have been made and in the process?
I thank the Auditor General for the findings, and I'm very committed to addressing the action plans identified.
Okay. Take two. Ms. Gillies.
Thank you, Chair, for the question. We have submitted an action plan in addressing the findings of the Auditor General, which we do think are extremely important. Thank you.
Did something go gravely wrong here?
As I said, we do agree with the Auditor General's recommendations, and we are actioning them. Thank you.
Okay, Mr. Tremblay.
Same response.
Same response to which? The latest?
Yes.
Okay. Thank you. Maybe just to the Auditor General. Is it your findings that things have gone gravely wrong, and are you surprised that someone didn't notice earlier in the process that there wasn't an effective collection of data or response to it?
Our audit did identify that the government set a important target in the national housing strategy, and none of the entities we audited felt that they were the lead responsible to ensure accountability and achievement of that target. I think it just flows that when you're accountable for something, you set yourself up to measure it properly. What we saw is that data's being collected, information's being collected. It's not fully analyzed, but it is more about outputs than about outcomes. And this target is one that is really outcome driven, which is to see that those most in need have been housed and that chronic homelessness and homelessness has decreased.
Yeah, thank you very much for your work. My conclusion here is that nobody was responsible for achieving this target or saw themselves as responsible for achieving this target, and nobody thought that was an issue. Even up until now, when it's been pointed out, there's a formal acceptance of your findings, but I don't get a sense of the appreciation of the gravity of what's gone wrong at all, and I look forward to being able to engage with the minister on it. Just to follow up my colleague Mr. Aitchison's point about bonuses, in spite of the findings of this audit and the larger situation in terms of dire worsening of the homelessness situation in our country, significant bonuses were paid out. Just to follow up on his question, who makes decisions about bonuses paid to senior public servants? Is that a decision made by the minister, by public servants themselves? Is it automatic? Where does that decision come from?
Thank you, Chair. I'll answer just with respect to CMHC, which is an independent Crown corporation. We are governed by an independent board of directors who approves our compensation framework and recommendations with respect to the bonus framework as well.
Thank you. I've got 30 seconds. If I could hear quickly from the other two deputy ministers, please.
Senior public servants in the core public service, the Treasury Board Secretariat has a policy that all departments follow in how they approach performance management.
Who makes the decision, though? Who signs off in that policy?
So there's different committee works in Infrastructure Canada. In the end, the application of individual performance bonuses to individuals would be the Deputy Minister, but it is within Treasury Board guidance and guidelines.
Be consulted on that? Would the minister be consulted on that?
And thank you, Mr. Genovese. You will have another very brief opportunity in another round, but to ensure that happens, I'm going to keep us on track. I believe the next member is Ms. Bradford.
Thank you, Mr. Chair, and thank you to all the witnesses that are here today. So our government believes that housing is a human right. So, Ms. Bowers, could you please explain how the National Housing Strategy reflects a human rights-based approach to housing?
Thank you very much for the question. The significance of the National Housing Strategy is the focus on housing as a human right. The National Housing Strategy is constructed to serve the needs of all Canadians. So there are programs to address housing needs across the housing spectrum. Having said that, there is a recognition that the government has to play a most active role in serving the housing needs of those most in need. So when we are developing the programs for the National Housing Strategy, we ensure that the bulk of our funding, in particular, things like grants and contributions that are non-repayable, are directed towards those nonprofit groups and other organizations who are helping those most in need.
So according to the OAG, the National Housing Co-Investment Fund had a measure for affordable housing that was not the same as the National Housing Strategy overall. The result of this was that the rent for approved housing was often unaffordable for low-income households, many of whom belong to priority vulnerable groups. What steps do you plan to take to harmonize the definitions of housing affordability?
Thank you very much, Chair, for that question. We use different levels of affordability based on the nature of the program. The co-investment fund provides housing for those most in need, but there's also a concept of funding projects that provide mixed-use projects, so housing projects where there is a range of people with different income levels. So in recognition of the varying needs of housing providers, we have some flexibility regarding the affordable housing definition. We do have sub-targets within the National Housing Co-Investment Funds for those most in need. And for example, to date, we've funded 3,700 shelters, we've funded 1,600 transitional housing units where the affordability that's achieved is very low. But we also have housing where there is mixed use, and in those units, we have units that are of very low affordability, but mixed in there are housing units for Canadians who are in maybe the second or third income quintiles as well.
So CMHC reported that as of March 31st, 2022, over $9 billion had been committed to the 6 initiatives examined by the OAG, and some $4.5 billion have been spent, representing about 30% and 15% of planned expenditures, respectively. Why is the actual spending such a small share of the planned spending, and how do you plan to correct that issue?
Thank you again for that question. The National Housing Strategy is a 10-year program. We have spending targets by year. Our intention is to commit the funding by the end of the program. When you look at the national housing programs as a whole, we're about 50% into the execution of the strategy, and we're about 50% in terms of commitment of funds. I do want to point out that there is a lag between funding and actual occupancy of the housing units. Housing takes a long time to construct, and oftentimes that's what results in a delay in terms of providing information about who is benefiting from those housing units.
So Exhibit 5.4 of the report also shows that between 2016 and 2020, the number of people using emergency shelters fell, while the number of shelter users who were chronically homeless rose. How do you explain this discrepancy, and will it result a spur of change in the funding strategy? And if so, how?
I will answer that question. Okay. During the period of time, during the COVID experience, the shelter capacity was reduced by about 30%. So there wasn't as many shelter spaces for people to use. That said, temporary measures were put in place, And we did have 137,000 people avail themselves of those temporary measures, of temporary spaces. So there was a reduction in shelter capacity during the pandemic.
Okay. So I believe that's all the questions I have. Do I have much time left?
No,
Mr. Chair?
you got 27 seconds.
That's fine. Okay.
You done?
Decide who gets it. I think.
Okay. Just to confirm, you're done?
Yes, I'm finished.
Very good. All right. It is now 5:33, so we're going to have. There's lots of questions here. We're going to have kind of lightning rounds, 2 minutes each for the government and official opposition members, and the Bloc and the NDP will have a minute each. And we will. Sorry, that's 2 spots for the Liberals at 1 minute, 2 minutes each, and 2 spots for the Conservatives at 2 minutes each, and the Bloc and the NDP will each have 1 spot at a minute each. So without further ado, I will turn to Mr. McCauley. You have the floor for 2 minutes.
Thanks, Mr. Chair. Ms. Bowers, I wanted to get back to the comments made by the federal housing advocate. Have you met with Ms. Houle?
Yes, I've had the privilege to meet with Ms. Hull. She's a member of the National Housing Council, and I've had probably the occasion to meet her on 4 or 5 occasions.
Okay. Her comments that you disagreed with, that the strategy is failing, we're seeing homelessness rise across the country. As been stated, there's tent cities, people losing hope, deaths, and then, of course, we have this horrific report. And then we have our federal housing advocate saying that the system is failing, but you disagree with that. You disagree that the strategy is failing, despite what our federal housing advocate says, despite what the evidence is saying, despite what the Auditor General's report is saying, you don't agree that the strategy is failing.
The National Housing Strategy represents the re-entry of the federal government into funding affordable housing. There's been significant progress made
I'm
in
sorry,
making
but those
sure
are
that
wonderful
nonprofit
talking points.
organizations.
But you don't agree that the strategy is failing. Let me just ask you, just on the AG's commentary about the lack of data from CMHC. I'm looking at your corporate report from 2022-2026. The top 2 items, how we achieve our strategic results, specifically are around data gathering and using such data to inspire, influence change, intensify our research and analytics, improve data availability. And yet the AG comes along with a report that says CMHC is basically doing the opposite. Why the dichotomy between what your strategic plan report says and reality?
Data is very important to making good housing policy. CMHC is very actively engaged in improving the quality of our data sources. Like with many data initiatives, this takes time. We're very committed to making investments over time to have the best quality data to serve Canadians, those most in need.
Thank you very much. Turning out to Ms. Yip, you have the floor for 2 minutes and a few seconds.
Thank you, Chair. This is for Ms. Bowers. Given the transitory nature of homelessness, the people affected are in and out of emergency shelters and other support services. How can data be collected accurately?
So for this one, if I may, Mr. Chair, I think DM Gellis may be the best person to answer this specific question because it's more directly related to homelessness.
Thank you, Chair, for the question. What we do is we work with our community entities and our shelters across the country to provide us shelter data. And we have just received, and the Auditor General rightfully points out, in 2019, we did not get that data. And that was because, one, of COVID, and they changed the capacity, as I mentioned before, reducing it by about 30%, and then increasing capacity with temporary shelters being put up. So we had to change our methodology to be able to capture accurate information. We are catching up with that, and in the coming, before the end of this calendar year, we'll be publishing the shelter data for 2020, and soon into 23, we'll be publishing the data for 21 as well as 22. And by the fall of next year, we'll be completely caught up in the cycle of the normal data capture on the homelessness systems across the country.
is that being captured in the placetocallhome.ca? Did that
So,
yeah, sorry.
Thank you, Chair. As part of our action plan, we are looking at a more efficient way to capture the data. So right now it comes in different formats from communities and shelters across the country. And to do it in a more efficient way, we've actually hired a consultant to look at how do we automate it. And we provide a free system to community entities called HIFIS that they can use to be able to use as their kind of case management system. So we're looking at that as a way to automate and have a more efficient, timely capturing of the shelter data information across the country.
That is the time. Turning now to, if the answer had gone on a few more seconds, I would not have cut off the witness, but we just don't have time to get into a whole new round. But another of your members will have 2 minutes. Mr. Trudel, vous avez 1 minute.
1 minute, Mr. Trudel. Thank you, Mr. Chair. Ms. Bowers, in Quebec, an individual who lives on welfare earns very little money, very vulnerable person. For rent, for affordable rent under the CIS, it's $550. So in Quebec, the most vulnerable people can't pay for affordable rent. It doesn't make any sense. That's why we have social housing, who gives 25% to people who fill in the gap. Earlier, you gave some figures which don't really correspond with the figures I have. I'm talking about social housing in Canada and how many social housing units were there in Quebec.
So in terms of, there's approximately 650,000 social housing units across Canada. I don't have the breakout by province, but I'll be able to provide that to you after the committee. My apologies for not having that information.
Très bien. And if you could provide that, please, that would be most helpful if you could provide that, please. Mr. Desjardins, you have the floor now for 1 minute.
Thank you very much, Mr. Chair. I'll jump right into it. I'd like to quote the Auditor General in her last response, in her opening response, quote, "One of my biggest concerns is the lack of federal accountability for achieving Canada's target to reduce chronic homelessness by half by 2028. I echo again the importance of accountability in this committee. It's second to my point. The National Housing Advocate uses the word failure in her response and audit of this work of CMHC and the National Housing Strategy. How can I or members of this committee or Canadians be satisfied with the responses provided here today? I'm not satisfied with the responses that the witnesses were presented to us today. I believe they're unsatisfactory to the core of the mandate of the Auditor General's report. We didn't hear, in fact, an admission of failure that it was on 2 accounts in particular, 1, data, and 2, being actual outcomes. I have no questions to ask any further other than encourage folks and make really certain that you understand how important this is to Canadians to ending homelessness.
Thank you very much, Mr. Desjardins. Turning now to Mr. Atchison, you have the floor for 2 minutes.
Thank you, Mr. Chair. I guess I just got to come back to the situation in this country. We've talked about the housing continuum and the spectrum of housing, and I think it's safe to say that from all reports that it's in a crisis, from everything from shelter beds to people trying to buy their first home. Home prices have doubled in this country. The housing affordability gap, that's the average price of a house versus the borrowing capacity of the average household in Canada, is now a whopping 67%. Canadians are spending like 64% of their income on their housing. Just before this government took office, that gap was 2%. And so the crisis is real, and this all seems very bureaucratic, and everything's going to be fine. Don't worry, because we're gonna have someone take the lead here shortly, but we're gonna get this done in another year. All the while, the proof of the failure is not in the reports from the housing advocate. The proof is in the growing tent cities in this country. The proof is in the growing number of homeless people in all our cities. The proof is in the number of people turned away from those shelters beds. The proof is in the number of people literally dying in our streets. We seem pretty calm and pretty casual about this. It's failing. We've heard it. We can see the results. We simply are not doing enough. And so my question, quite simply, to I guess Ms. Bauer would be if you're not spending the money that's been allocated, why would you want more? It was a request. You said the solution to Mike Morris was...
Please allow an answer.
So as I indicated, we are allocated funding on an annual basis, and we are successful in funding projects as we receive them. There's no question that the nature of the housing crisis in Canada is serious, and CMHC is very committed to working with our partners across the federal government, across all levels of government across Canada, with the private sector and the nonprofit sector.
Thank you.
In my view, housing is a team sport.
There's one more round, and it's going to a government member. Ms. Shanahan, you have the floor for 2 minutes.
Chair, it's to Mr. Fragiscatos.
Oh, pardon me, Mr. Fragiscatos, excuse me.
No problem, Chair. I respect and admire, frankly, the passion of colleagues around the table. I know Mr. Atchison comes from the municipal level, and he's proved an effective MP wrestling with a number of hard issues, and so I know his sentiment is sincere, but I would put to him respectfully that homelessness is the result of many things, but we're not going to deal with it meaningfully when cuts are being called for. So when I hear my Conservative friends in the House, for example, so frequently target EI and call for effectively EI to be cut, it seems a bit rich sometimes when I hear this kind of questioning. But I'll leave that.
Point
there.
of order, Mr. Chair.
Really a point of order?
Yes.
Mr. Genuis, I know where you're going here, but if you don't like what's good for the goose is good for the gander. And Mr. Fragiscatos, you might not like what he's saying, but it's his time.
No, I don't mind what he's saying at all. I think it's quite revealing, actually, of what the government.
What's your point of order? What's your point of order?
No, my point of order is that this committee has a particular mandate around reviewing audits, and Mr. Fragiscatos is quite liberal with his application of points of order to others.
Okay.
He's going so far outside of the committee's mandate to grandstand on utter nonsense that's
Mr.
obviously
Genuis,
not
stand
true.
down.
Thank you, Mr. Chair.
I'm going to turn it back to Mr. Fragiscatos. You have about a minute and 10 seconds, sir.
The question goes to Ms. Gillis, recognizing that the challenge of homelessness is not only a federal responsibility. To what extent is the Department of Infrastructure engaged with provinces and territories to share information and establish even shared outcomes in terms of dealing with this? I think that collaboration is necessary. We've heard about the importance of greater collaboration between CMHC and infrastructure at the federal level, but what about the engagement with provinces and territories?
Thank you, Chair, for the question. That's a really important partner in dealing with homelessness across the country. I mentioned yesterday that Romy and I were at, Ms. Bowers and I held a federal, provincial, territorial meeting with deputy ministers of housing across the country with full support and agreement for us to work together in creating a working group and how do we align better. And when we look at Reaching Home, that particular program is working with community entities that also work with provinces and territories. So we have advisory boards where provincial representatives are often on those boards, as well as ourselves, to make sure that we're leveraging all of our programs to make a difference within those communities.
Thank you very much. I will quickly thank all the witnesses for coming in today. I again apologize to members for not being there. You know, I prefer to chair these from the committee room. That was just not possible today. La réunion est adjournée. Merci beaucoup.
The meeting is adjourned. Thank you.